Hi, I'm Krista Lamb, and I'll be your host for a series of conversations we're calling Your Health and You, Diabetes 2. This is a short series where I will chat with Dr. Arun Garg about type 2 diabetes in the South Asian community. Dr. Garg is a medical doctor from the South Asian Health Institute and also part of the Canada-India Network Society. We're going to talk about type 2 diabetes in the South Asian community. These chats are presented by the Type 2 Diabetes Network, which is a part of the Institute for Health System Transformation and Sustainability. I look forward to sharing them with you. Welcome to the show, Dr. Garg. We're really excited to have you here. And I wondered if you could tell us a little bit about your background, who you are, what you do.
Thank you. So nice to be with you. Really happy to be with you. This is wonderful. I'm a medical doctor who has been in practice for over 40 years. My field of interest is biochemical medicine, which really talking about biochemistry of the body and how it affects and the lab testing. So that's where I spend most of my energy and time. But my passion is building healthy society. And in it, we established Canada-India Network Society and have a passion and deep support for creating healthy society through innovation, education, and empowerment of the individuals. So I'm really happy to be sharing some thoughts on certain aspects of health today with you.
Wonderful. So let's talk first about diet and type 2 diabetes. We know that that can have a really big impact on prevention and management for people living with type 2. So can you tell us a little bit about why you think that's so important?
Diet and diabetes. Yeah, food in general, people call it diet, is the energy and the sustenance of a person. And food really drives everything in terms of biochemical energy, which then leads to diabetes and the imbalance, but also the social aspect. So I think from both of those point of view, it's so critical that the food becomes a primary source of not only energy, but also lifestyle. And both of those play a major role in diabetes.
And with the South Asian community, which is the community that you work in specifically, you've mentioned there are things about diet that should change. So how can people balance enjoying culturally meaningful foods while they're still eating healthy?
Yeah, that's a very good conversation to have. First of all, let me say right up front, South Asian diet or the cuisine or the food based on South Asian heritage, which is India, Pakistan, Bangladesh, Sri Lanka, Bhutan, etc., is very healthy. So there's not a conversation about unhealthy food. But what we're talking about is how to make it appropriate in 21st century because of industrialization and what else has happened. So the food itself, the content and the cuisine is very healthy. As a matter of fact, there is a long tradition of healthy food. So what are we really talking about is balance. So the food you could think of from a two angles. One is the biochemical composition, which everybody talks about, which really is the balance. So it consists of macronutrients like carbohydrates, proteins, fats, and supplements, and vitamins, etc. And there has to be a balance in it. So I think one of the big things has happened in post-industrial era that food has lost that balance. And I think we need to really make a concerted effort to bring a balance between proteins, fats, and carbohydrates. And diabetes, especially diabetes 2, is very much integrated to the amount of carbohydrates. South Asian diet has lost the balance because of the social habits and because of the taste and all those things become much more preponderant on carbohydrates. And the balance between proteins, fat, and carbohydrate is lost. So I would say first and foremost is we need to pay attention to that balance. And that balance could take in form of carbohydrates, major carbohydrate being grains, because like bread, chapatis, rotis, naan, parathas, puris, list goes on, and rice and potatoes. So those three are the major staples of carbohydrates. And if you just eat those three with very little protein and fat, you have a problem. So I think that's what we're talking about, minor changes in food habits related to the balance of the biochemical composition.
So, really, just talking about looking at, are you eating enough protein if you're having carbs? Are you having too many carbs? Things like that.
Yeah, that's right. And I think they balance each other out. And also because food eventually is converted into energy, and that energy then produces the body components like muscle, fat, and they all burn in the energy of each other. So that's why it's also very important to have that balance. And I think you need to be aware. And I think the big awareness is, what are the proteins? Where do you get them? What food are good in proteins? What food is good in carbohydrates? And what kind of carbohydrates? And that awareness, I think, is the most important piece in terms of South Asian diet and South Asian food habits.
And one of the things that you have mentioned in the past to me, which I thought was really interesting, is that we also have to be thinking about why we're eating. How do you see that, and what is the importance of that?
Yeah, so I think beside biochemical composition and beside knowing what you're eating, very important is lifestyle related to food. Food is the mainstream in terms of social habits, and that gets into why you eat, when you eat, how you eat, and how much you eat. So let's taking why. One obviously is to provide energy and to provide hunger and to make sure you're having enough nutrients. The other component, it's very culturally specific. Food is also a big component of social behavior and social interactions. So people, when they visit each other, everything has to be around food. Even if you're not hungry, you just had a big meal, but you are asked, "Oh, let's have some tea." And that tea relates into major energy consumption. So that's what I mean when I say why you eat. So social part of the eating, obviously very important, but you need to be aware. So if you just had a meal, just not overindulge. Why you eat also has relationship with besides social part and hunger part and the energy part, related to connecting with other family members and festivals, because South Asian lifestyle and South Asian culture is very much embedded in festivals and celebrations. So weddings and all those things are very heavy on food as the primary component, and one has to be aware of that.
Yeah, that's really, really interesting because we often think about food as a celebration. We look at food in so many different ways. So, really, really interesting. And you also mentioned just now about the times that we eat. And so, what do you mean by that in terms of, are there better times to eat? Are there things that we should be thinking about in terms of how we plan out our meals?
Yeah, I would say big essence of today's conversation is when we eat. We talked about is big emphasis, but that is not as important as when you eat. And one thing good about South Asian culture and tradition is that it has been very prescriptive in when you eat. So, for example, it says that you should not eat after sunset, and that being to give body rest and big body opportunity to able to digest food. However, with industrialization and with changes habit, that has really changed. And I would say if there is one small change we need to make, we need to really pay attention to when we eat. And social behavior, banquets, celebrations, festivals, they all have very late eating. So it's not that uncommon to have major meal way beyond sunset, say 8 o'clock, 9 o'clock, even 10 o'clock. And I would say that is one of the major reasons for losing imbalance. So I would re-emphasize that when we eat is very critical, and this is where we need to make some changes. So what should be the biggest meal? It should be during the day, not towards the end. Morning breakfast is important because to give you that energy, and the evening meal should be the lightest because of the social component, it's the heaviest. So I would say eating before sunset is critical for healthy balance.
So, for a lot of people, they may have heard of intermittent fasting. Is that sort of what you're talking about? A lot of people are talking about it, but not many people know what it means.
Yeah, no, I wasn't thinking so much of intermittent fasting. That is a modern concept related to allowing body a certain amount of fasting. However, it might be indirectly embedded in those prescriptions, which are very age old, where they prescribe to have meals only at a certain time and before sunset.
And if someone is listening and they're wondering, are there places where they can get resources to help with this, in particular from a South Asian perspective? Is there something that they should be looking for?
Yeah, I think there is a fair amount on websites. Fraser Health has a South Asian Health Institute, and there are a fair amount of information on type of food and food habits. Canada India Network Society website has fair amount if one was interested in that information. I think even Diabetes Canada has fair amount, but mostly on type of food and more on carbohydrates and carbohydrate composition. So far, the emphasis on when you eat is not as preponderance. The science of health, Ayurveda, which is the South Asian based tradition of health and healing, has fair amount of emphasis on food. So it describes the food and its attributes, and also it prescribes that you should be eating before sunset. So I would say some of that literature will also have information.
Wonderful. And is there anything else that you think that people listening should know about the ways that they're eating, especially if they're living with type 2 diabetes or are at risk for type 2 diabetes?
Yeah, especially at risk, because pre-diabetes and prevention is worth a pound, ounce of prevention is worth pound of disease. And I would think beside the very specific when you eat, the two components of food which have played a major role in diabetes is simple sugar. So we talked about carbohydrate, which are complex, like in terms of grain. But simple sugar is the major culprit where we load body with sugar. So I would say people should pay real attention to cut down on simple sugars, the white refined sugar. And that for South Asian diet is a big, big factor in drinks. So coffee, tea, and beverages. And unfortunately, all of those are very much embedded in adding sugar. So I would say if they don't remember anything from this podcast, my key message would be no added sugar. And good news is that now most of the labeling on food is starting to show added sugar in it. And added sugar is really relating to simple refined sugar, not complex carbohydrates. So I would say that is a big area where you could really lower the prediabetes and help yourself in delaying diabetes and even reversing diabetes, certain types, by controlling added sugar.
And that's really interesting because with many of the drinks in the South Asian culture, there is a great deal of sweetness. So, for example, if someone's listening and they have chai all the time and their chai is very sweet, is there a way that you would suggest that they cut down gradually? How can they go about drinking something with less sugar?
I think awareness is the most important thing. And then you have to train your mind. This is where behavior modification becomes very hard to change. It's like addiction. And sugar, especially glucose, is a great addictor. Some people say it's worse than opium. So it requires a very concerted effort. And this is where mindfulness plays a role. This is where mind and the yogic concepts play a role. Yeah, and I think the way to do it is first be aware that I'm adding the sugar. People do it without even realizing. And 1 teaspoon is 4 grams of sugar, 1 tablespoon is 16 grams of sugar, which is a lot of sugar. And we need to cut that. We should be made aware. There should be signs by the coffee pots, teapots. Now, good news I've seen is that people are starting to ask for sugarless tea, and I think that's a good start. So, awareness is the most important piece. And once you're aware, then making a concerted effort through mind that I need to cut it and then slowly and gradually totally wean off. And I would say that simple step can prevent onset of type 2 diabetes of certain types in most people by many, many years.
Wonderful. Well, this has been such an interesting conversation, and I think that I've learned a lot, and I hope people listening have too. So thank you so much for joining me on the show today.
Pleasure is mine, and it's always good to talk about healthy society and healthy living through food.
I'm Krista Lamb, and this has been Your Health and You, Diabetes 2. For more information about this topic and many others, please visit ihsts.ca. We'd love to share more information with you. Thanks for listening.